So my name's Charlie Elliott. I'm a consultant, so I'm a medical doctor and I work at the Pulmonary Hypertension Unit in Sheffield.
I'm Paul Corris. I was a transplant physician and professor of medicine in Newcastle, and my first inroads in transplantation as a senior person, if you like, was in 1987 when I was involved in the first successful single lung transplantation in Europe.
We know that medication alone doesn't cure pulmonary hypertension. It can prolong life and improve quality of life brilliantly. It's the medication we have now compared with 10, 20 years ago has transformed the treatment of pulmonary hypertension. But transplant is an integral part of that treatment for patients who are failing on medical treatment.
So lung transplantation will still remain, and still certainly at the moment remains, a very important core treatment option for a subset of patients with pulmonary hypertension. There's no doubting that after a successful bilateral lung transplant, the PH patient can go back to a near normal life with near normal exercise capability and a life expectancy that now on average would be 10 years or greater.
Not everybody who needs a transplant can have a transplant. We hear this in the news on a weekly basis. We know that people go on transplant lists, but that there aren't enough organs to supply or to meet the need of all those patients on transplant lists. That goes for lung transplants, heart transplants, all sorts of organ transplants. So talking about transplantation is important from both sides of this. From a patient side, if you're a patient with pulmonary hypertension, to know that transplantation can be something that you may need in the future, and for people who don't have pulmonary hypertension, to know how important transplantation is for patients who have incurable diseases.
The new law will assume everybody wants to be an organ donor unless they specifically opt out.
Because even if consent is deemed, organs can't be used unless family, next of kin, give their consent after somebody dies. So an individual may strongly wish for their organs to be used to help somebody else live a longer and fuller life, but unless their family are aware of that and agree at the crucial time, then those wishes can't be fulfilled.
Because it's far more likely that a family, having discussed it with their loved one beforehand and knowing that that's what they wanted, would access and say, yes, please use those organs.